have to say that Johns Hopkins dashboard, which you can find that tracks the cases in real time, is the best thing I've seen on it. So congratulations for that. After a slow start, how is the United States doing on testing?
Well, we still, as Governor Cuomo just said, we still have a long way to go to get us where we need to be to really tackle this virus. But we certainly made great strides in the last month.
So let me ask you a couple of questions. Testing is the best way we can find out who has the disease at any given moment. But roughly, is that capturing all of the people who have it? In other words, how many people might have this disease who aren't being tested either because they choose not to be or they can't get there to get it done?
Well, I think currently our biggest issue is the lack of testing opportunities. I think if we had more testing available, people would take advantage of it. And I think that would really be helpful to get a better handle on what the statistics actually are at this moment. So I think that's the major issue for us right now, is to really expand access to rapid testing, get the results turned around much more quickly than they are now, so that we can actually identify people at risk and then do the kind of contact tracing that you just heard described as being proposed in Massachusetts, and as well as in our own state in Maryland. Governor Hogan just announced the launch of a public health strike force to help us with contact tracing and testing as well. But we just need access to the tests.
Do we know what the false negative rate is on these tests?
Well, we don't have a clear idea yet, and there are many different kinds of tests, as you just talked about. There are antibody tests, and then there are what we call nucleic acid or PCR tests, and they're different kinds, and they all have different kinds of sensitivities, and we're just sorting that out. But they're actually pretty good, and if we could scale those up, I think we'd get a lot more information that we could act on.
Let's talk a little bit, if you don't mind, about China. I cannot believe how the number of cases fell and new cases have basically dropped, according to what numbers I see on Johns Hopkins dashboard, have fallen to basically 0 per day. Do you believe those numbers? What happened there?
Well, I think that they did an incredible job with quarantining, social distancing, contact tracing. Of course, the state there has more power to implement some of these steps. But they were much more aggressive in their contact tracing and testing than we've been to date. But I think we're making steps in that direction, as you just heard from Massachusetts and elsewhere. That's the next step. We have to really move not only to continue our distance measures, but also do contact tracing and testing to really allow us to move the economy forward, get back to work.
There's a question of when will we get back to normal. I know that is kind of an unknowable, but how will we know when the time has come, based on the testing, based on the contact follow-ups that we do, that we can begin to inch back toward a different kind of normal, but normal?
Well, I think and when we start to see the rates going down, as we've seen in China and certainly beginning to see in some parts of Europe, when we start seeing those rates of new infections going down, when the death rates go down, the virus is not going to go away until we have a vaccine. So we're always going to have to find strategies to deal with this to prevent the next wave. And that's really what the next steps are really focused on, which is rapid testing and contact tracing. If we can really get that testing up to the capacity that's needed, I think we can go a long way towards inching forward in the direction you're asking about.
Dr. Bollinger, thank you very much.